This course is called Cleft Palate and Craniofacial Conditions. Hi, I'm Ann Kummer. I am the author of your textbook and I'm also the instructor for this course. Before we start, I'd like to tell you a little bit about my background and about how I became so passionate about working with children with clefts and craniofacial conditions. I'm going to start out with my education. I completed my bachelor's and my master's degree at Indiana University a long time ago. After I completed my master's degree, I took a job working in the public schools of North Carolina. I took over a caseload from the previous speech pathologist, and on that caseload she had a child, a little boy who was about 8 years old. He'd been in speech therapy for 3 years, and according to the records, he had made no progress in those 3 years. Well, I couldn't understand how that could possibly be. So I did a test, I evaluated his speech, and I found that he had perfect articulation, but he had terrible speech. Now, how could that be? Well, because at Indiana University, I had one course on voice and resonance disorders. And in that one course, I had one class, actually, on resonance disorders and cleft palate. I wasn't exactly the expert. However, I suspected that the child had velopharyngeal insufficiency. So therefore, I called the parents, I talked to them, I suggested that they take their child to an ENT for an evaluation. They agreed to do that, took their child, the ENT looked in the child's mouth and said, "Everything's normal, do speech therapy." Now, I'm ashamed to tell you today that that's what I did. I did speech therapy. I have no clue exactly what techniques I used, but I had this child in speech therapy for a year. Now, at the end of that year, I had accomplished only one thing, and that is that I further negatively affected his self-esteem. Because what I know now that I didn't understand then was that this child had a structural problem, not a functional problem. So the last time I looked, speech-language pathologists cannot correct abnormal structure. Now, I suspected that, but when I referred to the ENT, I thought that the ENT would know more information about this than I did, and I was wrong about that. ENTs are typically not trained in this area, and so unless the ENT works on a craniofacial team and specializes in this area, the ENT doesn't know very much about this area. Now, what I do know now that I really wish that I had known then was that I should have referred the child to a craniofacial team. At the team, there would have been specialists who would know about velopharyngeal insufficiency, be able to evaluate it and treat it. What this child needed was surgery, not speech therapy. So this has been years ago, but that still weighs on me. I wonder what happened to that child who's now an adult. I wonder what his educational and vocational opportunities were, what his relationships were like. I mean, in the 3rd grade, he was being teased constantly for his speech. So it really worries me. And I hope that the speech-language pathologist that succeeded me was smarter than I was and did the right thing. Unfortunately, I sort of doubt it. So I'm pretty passionate about making sure that this doesn't happen to other speech-language pathologists. All right, so after working in the public schools for 3 years in North Carolina, I got my dream job working at Cincinnati Children's. And a few years after I joined the team there, I was asked to serve on the newly created Cleft Palate Craniofacial team. Well, I really found my love in working on that team. And a few years later, an ENT and I developed a VPI clinic for non-cleft resonance disorders. So I got a lot of experience with that. Now, while I was developing my clinical career, I was also asked to be a leader. And so in 1981, I was asked to be the director of a relatively small department of speech-language pathologists. I was later named the senior director of a large division of speech-language pathologists. In fact, when I retired from that position in 2017, we had been the largest pediatric speech-language pathology program in the country for many, many years, and probably in the world. All right, so in my career, I had a main job of being an administrator. I loved that job. I loved program development. I loved working with others and promoting their careers. But my passion remained with working with children with craniofacial conditions. So in 1982, I actually went back to school. I went to the University of Cincinnati to obtain a PhD degree, which I did obtain in 1986. As such, my clinical care, research, teaching has always been focused on children with Cleft's craniofacial conditions and resonance disorders. I've had so many years of experience working in this area and working closely with other professionals on our craniofacial team. And in that way, I've had an opportunity to learn from their respective disciplines so that I have a better understanding of the complete care of patients with clefts and craniofacial conditions. So because of my good fortune to have learned so much in this area in a very long career, I'm now very passionate about sharing this knowledge with others so that children receive the treatment that they deserve. That's why I wrote this book, now in the 4th edition, and also why I continue to do a lot of teaching. So I'm particularly excited about sharing my experience with all of you in this course. I want to thank you for the interest in taking this course. I really hope you enjoy it and learn a great deal. So let's get started.